Hello, amazing people. How you all doing? It's your favorite healthcare provider here, Veohmo HMO. Today we'll be talking about a very sensitive issue, hepatitis. We'll be joining the World Health Organization to mark this year, 2026, Hepatitis Day, with the theme, Hepatitis, Breaking the Barriers. This initiative focuses on breaking down barriers, stigmas, misinformation, and inequitable access to care and screening, as well as raising awareness, driving effort towards eliminating viral hepatitis. It is important that we encourage prevention, promote treatment, and freeway access to testing and screening. Because despite availability of vaccines, and curative oral therapies, millions of people out there continue to suffer from chronic hepatitis in our communities. Now, what is hepatitis? Before we go ahead with that, I would like us to understand that there is an organ responsible for hepatitis, which is the liver. The liver is the largest internal organ. It is also the heaviest gland in the human body. The liver has over 500 vital functions in the human body. But for the benefit of this awareness on hepatitis, we'll be talking on five. The first one is toxification. Detoxification. It is the responsibility of the liver to detoxify every toxin that enters into our body. It is also responsible for the metabolism of carbohydrates and the breaking down of carbohydrates to store energy. It is responsible for the production of bile, which help in the emulsification of fats. The liver is also responsible for filtering blood. The liver is one of the unique organs in the human body that has the ability to regenerate itself when damage occurs. That is why it is important to detect hepatitis, treat it early to avoid damage beyond control. In that case, we'll be defining hepatitis. Hepatitis is the inflammation of the cells of the liver as a result of viruses, excessive alcohol consumption, drug abuse, chemicals and certain medication, and autoimmune diseases. Viral hepatitis is one of the most common form of hepatitis and has become a public global health concern in our communities. For the benefit of this awareness and sensitization, we'll be talking majorly on five types of viral hepatitis. The first one is hepatitis A, usually contracted through contaminants from food and water. While hepatitis B, the one that is always deadly and all that, is contracted through unprotected sex and from mother to child transmission through childbirth. The third one, which is hepatitis C, usually contracted through infected blood related activities such as in barbing, pedicures, blood transfusion, and all that. While the hepatitis D, usually seen in people who already have hepatitis B but did not go ahead to treat. It seems like a complication of hepatitis B. In hepatitis E, usually found in immunocompromised people whose immune system are really low, like in debilitating patients, in HIV patients, in pregnant mothers sometimes, etc. That being said, we'll be talking about the ways by which you can prevent liver diseases and hepatitis. The first one is through sensitization and awareness. It is important that we all as a community understand the impact of hepatitis, especially the viral one. The next one is for individuals to avoid excessive consumption of alcohol, drug abuse, reduce interaction with chemicals that might affect the liver. And the next one, we'll be talking about screening blood before transfusion. One of the important and effective ways to prevent hepatitis is through vaccination. Secondly, use sterilized equipment for your medical procedures and pedicures. Then the oga kpata of them all. Practice safe sex and avoid reusing personal objects.
Some of the causes of hypertension include viral infection, excessive drinking and drug consumption, certain medication, harmful chemicals, autoimmune diseases, and fatty liver diseases that is caused from the consumption of sweet things. So we're going to be talking about the modes of transmission. We have several of them. One is eating and drinking contaminated food and water, also by physical contact of infected persons or their sweat. Mother to child transmission during childbirth, and lastly, unsafe blood transfusion. Pale stool, yellowing of the skin or eye, also known as jaundice, and severe joint pain. Note that a carrier might be asymptomatic, especially during early stages. So we're going to be talking about the treatment of hepatitis, and is largely dependent on the hepatitis you're diagnosed with. So here are some helpful tips: proper screening and regular checkup, hydration, good nutrition, use of antiviral medications to control infection and reduce liver damage. And lastly, stick to treatment regimen and avoid crowded places in order to reduce the spread of infection. Here are some key messages I'll be leaving you with. Hepatitis is treatable, preventable, and in some cases, curable. Break the stigma. Encourage people to seek help.
It is important that we highlight a few complications related to hepatitis if untreated. These include liver cirrhosis, which is as a result of scarring in the liver. Secondly, liver cancer. Thirdly, liver failure. And finally, death. And from us to you, we say,
Know your status today. Test early, treat early, reduce spread,
and
save a life.
Bye.
Bye.